Hello and welcome to this Rattle and Hum Sports podcast. I'm Bryan Houston, and with us today is Mika Bradford. She is a certified nutritionist, health advisor, pharmacy technician, and writer for Rattle and Hum Sports. Mika, how are you?
Doing great, Bryan. How are you doing this afternoon?
Doing great. Thanks for coming on with us. We appreciate it. Mika, as we record this, Louisville prepares to play Michigan for the NCAA Men's Basketball Championship, and one of the most vivid images of this entire NCAA tournament was that of Louisville guard Kevin Ware breaking his leg while leaping out to defend a player near the sideline in front of the Louisville bench in last Sunday's Elite Eight victory over Duke. There was no contact, nothing that we haven't seen a million times before in a basketball game, except in this case when Ware landed, his tibia just snapped. It was one of the most gruesome fractures I've ever seen. So since then, he's become the source of inspiration for the Louisville Cardinals and their fans. But let's talk about his injury from a medical standpoint. First of all, what comes to your mind when you saw the play where he was injured?
You know, Bryan, whenever I saw the injury, it was really breathtaking, and it would take anybody back. I mean, whether you've been in the field of nutrition, whether you've been in the field of medicine, because it was pretty immediate and gruesome. And looking at that, the first thing that I thought of was, what on earth would cause the susceptibility for a 20-year-old male who is fit and in great athletic form to have an injury occur to that magnitude? And, you know, some of the things that the physicians over the last week have hypothesized is they've looked at everything from, you know, could it have been preceding stress fractures? I mean, obviously that's something that many athletes can be working out and doing everything and not have an idea or a clue that those stress fractures have occurred. However, you know, a couple of the practitioners have mentioned in the slightest way talking about, you know, what are his vitamin D levels? You know, what are some of the nutritional things that could come into play? And I'll be honest, Bryan, there are a few things, because you don't expect to see this fit young adult who's in his prime athletically have an occurrence like that.
Okay, so are you saying that there could have been some way to avoid this?
You know, I don't think that we can ever say with any injury that you can necessarily have something that could avoid it. But what we do want to look at is what are some of the predisposing factors that, whether it be for Kevin or whether it be for any other athlete or individual, that could cause an issue with brittle bones or more porous bones. You know, and some of those things can be nutritional deficiencies, as well as certain medications. You know, in the world of nutrition and medicine and medications, we always have to look at the picture as a whole, and how, where there may be a benefit to one component, there may be a cost to another area. And so that's something that we are constantly juggling and looking at, even when we look at supplementation programs and profiles. And in Kevin's situation, you know, and just like one of the physicians on one of the morning shows had mentioned, the first thing that I'd be looking at is, what are his vitamin D levels? And while we've heard so much about vitamin D over the past couple of years, and even we've got some people kind of saying, really, could that really be that important? Absolutely, hands down. Because if those numbers are low, that could directly contribute to the bone matrix density that he has and the accumulation of bone.
We've seen a lot of information about vitamin D in the news and the media over the last few months, years. Why are we seeing so much of that, and is there more hype than truth to what we're hearing?
You know, originally, whenever we started seeing more news pieces come out about low vitamin D levels, a lot of people in the medical community thought, you know, maybe this is just a knee-jerk response. But in all actuality, quite a bit of research has been being done, even over the past 10 years. And indeed, we're seeing that vitamin D levels are truly lower. And a couple of things that can impact that, that typically we don't think about, because it's such a gradual, insidious onset, is we have to look at what we do on a day-to-day basis these days is dramatically different than what we did 50 years ago. You know, most of us today are indoors. We're either at our desks behind our computers, or we're going to be in our media rooms, or it's the nightlife. And if we are outside during the day, then most of us are using sunscreen. And while, granted, overexposure to the sun has negative attributes, underexposure can be just as detrimental. Because when you look at us as human species, we definitely were not walking around in cardigans and sweaters outside in the fields. And what's significant about that is that your body produces vitamin D from coming in contact directly with sunlight, with the UVB rays that, yes, in an overabundance can be detrimental, but are necessary for the production of vitamin D.
Okay, so bottom line is we're either going to die from skin cancer or from vitamin D deficiency. Is that what you're saying?
You know, it's all about balance. You know, too much of a good thing is too much, and not enough is not enough. It's interesting now. Even many of the dermatologists recognize that instead of saying no sun exposure, they say a conservative amount of sun exposure. And so how that plays a role with what we do differently, too, is that sunscreens, with even an SPF as low as 15, actually can inhibit the body from producing vitamin D because it's blocking the UVB rays. And so, you know, when we look at the different settings, when we go lower to the equator, people are basking in the sun more, and they're outside and they have longer periods of exposure, we don't see vitamin deficiencies occurring as much. But when we go up higher into the northern areas, not only do we see an increase in vitamin D deficiencies, but we also see a relationship with specific health conditions. And that's something that probably even over the last 5 years, they've associated different conditions, autoimmune issues that are related to low vitamin Ds. And part of that is because in reality, vitamin D is really a pro-hormone, not a vitamin. And it's something that we have to have. It's amazing to see that they've now done multiple studies showing increased risk of upper respiratory infection, also issues with weight management, because your body, you have to have vitamin D in order for your thyroid to function properly. And for all you men that are listening, maybe women, also many times whenever somebody goes in looking at testosterone replacement, it's not uncommon that their practitioner will run their vitamin D levels and they'll be low.
That's very interesting and also kind of hopeful at the same time. You mentioned conservative sun exposure. What would you call conservative?
You know, in some of the studies that they had looked at, Brian, is they looked at maybe, 10 to 15 minutes outside and literally to where you maybe get just a little pink. And, of course, the sun exposure is going to be dependent on your altitude and the climate and the zone and where you're at. But typically doing about 15 minutes a day to at least get some exposure is going to help support the body. While different health conditions and also a person's body mass index, so the size that a person is, that will dictate how much is needed. So the amount of vitamin D that's needed for optimal functioning by one individual may not be the same amount as another. And vitamin D isn't something that, if you're found to be low, that your practitioner prescribes, whether it's going to be the prescription form of vitamin D or over the counter, you don't just prescribe it and take it and then the levels come up and they stay up. This is a constant need, just like putting oil in your car or gasoline for your engine to run.
Okay, and then I want to follow up on what you talked about with the low testosterone in both men and women. If you are experiencing symptoms that would lead you to want to consider some kind of hormone replacement therapy or something like that, would you advise these folks to try getting on a vitamin D supplement first?
You know, what I would do is when they're going in, and I would think that a lot of practitioners are doing this now, but it's great to be responsible for your own health, is that when you're going in for your annual or yearly checkup, ask your doctor to run your vitamin D levels. The larger body mass index you have or more adipose or fat tissue, that just absorbs and sucks up the vitamin D, so it's going to get diluted. So it's all in relationship to how much you're taking in orally, to many factors like how much exposure you have to sunlight as well as your body size. And then the next thing would be, nutrition isn't some ambiguous thing. It really can be very finite. And so what we look at is when you get your blood work back from your doctor, then if you start supplementing, and conservatively 1,000 IUs is very basic. And so if you start doing 1,000 IUs a day, and then you go back for repeat blood work in 90 days, then you can get an idea of what kind of response are you getting from that dose, and is that dose truly optimal for you?
Okay, and so just to be clear, you check your vitamin D levels through your blood tests.
Absolutely. And your doctor, most insurance companies will cover it. It's really not an expensive test. Your doctor can throw it on with any other labs that you're doing. And it's really interesting to see because now, when you look at people that, and they've got some studies that there's some association, and they're looking further into the research with people who have low vitamin D levels and having more upper respiratory infections. Looking again at thyroid functioning, at not having an easy time with weight loss, or even having weight gain. So, yeah, your physician can order the blood test, and it's quick and painless, but that little bit of information can make a huge difference, not only in your immune system and bone density, and as well as muscle functioning. They're finding more and more information because, years back they identified vitamin D receptors in the muscle tissue. So I think we're just looking at the tip of the iceberg and how this one little vitamin, which really is pro-hormone, can really play a key role in numerous health conditions dealing with inflammation and the immune system, as well as endurance and strength.
You as a nutritionist also can tell us where you can get the natural forms of vitamin D in our food.
Well, now here's the interesting part. Vitamin D isn't really abundantly available in food sources. It is enriched in, of course, your dairy products, but typically you look at supplementation or exposure to UVB rays in the sun. Okay,
fair enough. All right, so bottom line then, what nutritional supports would an everyday person, not to mention an athlete, need to consider when recovering from an injury like the one Kevin Ware experienced?
The first thing, obviously, and I'm sure that his team of physicians have done this, but I'm sure that Kevin's doctors have assessed and looked at what his vitamin D levels are currently. And depending on what his levels are, and this would be the same for any athlete that's had a bone injury, or even some of the sports medicine physicians looking at just overall health, that you want to get a baseline. And so looking at where he's at now, and depending on how low, that would dictate the amount of supplementation. For an average person, 1,000 IUs a day, up to 5,000 IUs. I think if you look at the upper limits, typically they're saying 4, but you have to chart it and look at your blood work and then do your vitamin D supplementation for 90 days, go back and check it again and see where you're at. And that's truly the only way that you're going to make good sense out of what you're doing so you're not throwing mud at a wall. The other thing, too, is it's important to know that there are different forms of vitamin D. And for most practitioners, if somebody's clinically deficient in vitamin D, they'll write a prescription for once a week, sometimes once a month, but typically if you're really low, they'll do once a week, 50,000 IUs, and that form is D2, and that is a prescription form, and most insurance policies will cover it. The reason it's a prescription is because back at the time that product was established or incorporated into pharmacological supports, it wasn't available in larger amounts over the counter because the application was purely for extreme health conditions. Now, as we've learned more about the function of vitamin D as a pro-hormone and how so many people are nutritionally deficit, and because it is categorized as a vitamin, you can find it at any health food store in amounts as low as 400 IUs all the way up to 50,000 IUs in a capsule that would be a once-a-week dose. But it is important to be sure, because just like with any supplement, just because it's natural doesn't mean it's neutral. So when you're looking at vitamin D, you do want to know how much is optimal for your supplementation. Levels of anything over 8 or 10,000 IUs a day without a physician's guidance is not advised in any way.
What would happen if you take too much?
There are different symptoms with vitamin D toxicity, but I have seen clients before where they've taken either their spouse's prescription 50,000 IU vitamin D, and we've seen fatigue set in, nauseousness, feeling horribly sick, and they did it, the 50,000 IU every day for a week and didn't realize they'd made a mistake. So it's just important to be mindful about what you're taking and how, because too much of a good thing can be too much.
Okay, good enough. Mika, anything else that I've left out that you want to add to this?
Well, whenever we were talking about some of the things, whether it be, Kevin Ware or whether it be any other person recovering from an injury, what's so important is it's not just about the vitamin D. It's about looking at your antioxidants, your vitamin A, your vitamin C, even E. And the reason A is so important is because you have to have optimal amounts of vitamin A in order for your body to be able to support the production of new cells, what we call the epithelial cells, your skin, intestines, wound healing. Vitamin C is also wonderful antioxidant, and so when there's inflammation, whether it be due to injury or recovery, it is going to lend its electrons and help with kind of putting those fires out. So making sure that your body has the nutrients it needs, because there's a certain amount of nutritional supplementation that's appropriate for a person just in general state, but when you add and increase the level or body burden, it changes the requirements and demands that your body needs.
Great information, Mika. We really appreciate your time today on this podcast, and we look forward to reading more of your articles on Rattle and Hum Sports. That's Mika Bradford, who is, again, a certified nutritionist, health advisor, pharmacy technician, and writer for Rattle and Hum Sports. Thanks again for doing this for us.
Absolutely. I'm happy to do it, Brian, and happy to provide the support and information for all you Rattle and Hummers.
We are looking forward to talking to you on a regular basis, Mika. Thanks again.
Thank you.
All right, that's Mika Bradford. I'm Bryan Houston. This is a Rattle and Hum Sports podcast.